All righty, everyone. Good morning. We're here for our Cracking the Code webinar. I'm Dr. Michael Jones. And today, folks, we're not going to have you here long. Today, we're going to talk about the 6-point medical exercise program management system. Now, folks, we put this together because years ago, I taught in a couple of physical therapy programs, but I also taught in a medical school. I taught in an orthopedic residency program. And one of the key things in orthopedics was training the orthopedic surgeon or the to-be orthopedic surgeon how to appropriately manage the orthopedic patient. Well, as we have ventured down this path with medical exercise training, one of the things we come to realize is there is a need for a thought process for the medical exercise professional when they're managing clients. And this becomes important. You probably started out as a personal trainer, and then you decided that exercise was key in managing medical conditions. And then you jumped over into medical exercise training or medical fitness training. You took a certification, which hopefully laid the foundation for you to provide medical exercise training services. But the question becomes, once you've taken that course or gotten that certification, are you applying the information you learned in that to manage the medically based client? So with that, we wanted to introduce this 6-point medical exercise program management system. I advise you, if you are a medical exercise professional yourself, start to utilize this concept. If you are an owner of the facility, I would advise you to start to utilize this concept for all of your staff members in the facility when they're starting to work with a client and then on subsequent visits. It's a very simple process. It simply says, here's the thought process I will use in managing this client's medical condition with exercise. It's a very basic process, but it is one that makes you think intentionally in managing the client, as well as intentionally from the standpoint of always understanding where you are along the process in managing this client to their optimal level of function. So if you don't mind, we're going to go ahead and get started. Also, the recording for this will be available at crackingthecode.net. I imagine most of you went over there and you registered. Thank you for doing that. We're going to try to do these every Friday, as long as we possibly can, and give you tidbits of information to help you in building your medical exercise training practice. And let me say this before we move on to the first slide. Notice we're not going to give you just simply exercises. Folks, you know the exercises. We started the very first medical exercise workshop and certification, or post-rehab workshop and certification, back in 1994. As physical therapists, we thought it was paramount that you not just simply know the exercise, but know the underlying theory and systems as to how you apply the exercise to produce a positive functional outcome for the client. So this webinar series will go over those things. We're not going to look at just simply exercise, but the application of exercise and the business of medical exercise training. So with that, let's go ahead and get started. All righty. So the 6-point client management system, there it is. And you can see here, this system is along a pathway. You'll notice here, we start with the first step, and then we move into the second step, the third step, the fourth step, the fifth step, and the sixth step. And these steps may be taken numerous times. And what I mean by that is you'll use this on the first session with your client, but you'll also use this on the third, fourth, fifth, and 60th sessions that you'll do with your clients, because this is the mindset you need to have when you're managing that client with a medical condition utilizing exercise. Please, if you would, in the medical community, when we see a patient in the medical community, we see, yes, Mrs. Fletcher, but we first see Mrs. Fletcher has hypertension or diabetes and a hip replacement. Then we see Mrs. Fletcher, because the reason she's coming to us is for that medical condition. So we always have to have the medical condition paramount in our minds. It doesn't mean that we don't have a personal understanding of Mrs. Fletcher, but the medical condition comes first. In the fitness industry, it's the exact opposite. And now, folks, I've been teaching for 31 years, medical exercise specialists around the world. Your thought process is the client first and then the condition. What we're going to ask you to do, if you don't mind, is reverse that a little bit. Think of the client's condition first, and then all these steps will fall into place that we're going to go over. And now you have a better understanding of why the client is there from the standpoint of their medical issues And now you can apply exercise in a more effective manner. And with that, you can still have a personal relationship with the client, as in understanding all their concerns, their fears, and their doubts, and being able to bridge that gap between healthcare and fitness. But you have to have a thought process with that. So if you don't mind, we're going to go through it here. Number one, when that client calls you or they come in for that first session, now let's be honest, most people are going to send you a text or an email, or you're going to get an inquiry from your website. And with that inquiry, they're going to call you, send you an email, text message, or whatever. During that initial conversation, excuse me, you need to find out what the client's medical condition is. They've had a hip replacement, they've had a stroke, they have Parkinson's disease, they have arthritis. With that, you need to have a clear understanding of the clinical anatomy and pathology of their condition. Let me explain clinical. Not just simply basic gross anatomy. That's what you took when you became a personal trainer. You learned the muscles and the bones and the organ systems. That's basic gross anatomy. Clinical anatomy is now saying those muscles, bones, and organ systems, how does the disease process affect them? So a disease, an injury, or surgery, how does it impact the anatomy? And that disease process is called pathology. So you have to understand, with a client with a total hip replacement, okay, they've had a total hip replacement. I don't just simply need to know the muscles and the bones. I need to understand, with that hip replacement, was it an anterior approach or a posterior approach? With that hip replacement, what did they do? You don't need to know all the surgical procedures, but an idea of what that client's clinical anatomy is now and the pathology that may have led to that. For instance, with most hip replacements, it's either a result of arthritis or fracture. Those are just simply ideas that you have to have in your head. So in this 6-point process, the first thing you must understand is the related anatomy and pathology of the client's condition. Folks, if you don't know the anatomy and pathology of the client's condition, you're lost. You're just simply throwing exercise at the client, seeing what sticks and seeing what works. Number two, recognize the contraindicated activities and exercises. So if I know the related anatomy and pathology of the client's condition, then I should know what we should not do with this client. Recognize the contraindicated activities and exercises, what we should not do. Now, folks, back in the 90s, I was a big fan of a TV show called ER. I'm probably dating myself to some of you. But you remember at the beginning of the show, they would come crashing into the emergency room. The paramedics would bring in someone on a stretcher, and they come crashing in the emergency room, and the nurses and the doctors in the emergency room would all start interacting with the paramedics, and they would always ask the paramedics, "What you got?" The paramedic would say, "We've got a 42-year-old male with a fractured femur and a ruptured femoral artery. His blood pressure is this, his heart rate is this." So what they were doing was getting that information or sharing it with the doctors so the doctors would know immediately what not to do. Maybe they would even ask if the guy has any allergies, anything else going on. Because what you don't want to do in any situation, work with a client with a medical condition, is do the wrong thing. So number one, understand the clinical anatomy and pathology of the client's condition. Number two, what should we not do with this client? With a total hip replacement, a posterior approach, we don't want to do too much flexion, hip flexion, adduction of the hip, and internal rotation, because that can cause that hip to dislocate. You can do anything else, just don't do the contraindicated activities, and make sure you recognize those and note them down, especially if you have other staff members working with you. So number one, understand the clinical anatomy and pathology. Number two, recognize the contraindicated activities and exercises. Number three, understand the key assessment procedures. Now, folks, this is one that has baffled us for 30 years. We teach in the MES course a specific guidelines for the assessment of various medical conditions, range of motion, strength, maybe some specific testing procedures, not to diagnose, but just to get an idea where the client is. Here's what we find. A lot of our MESs, after they take the course and pass the exam, they get out in the field and they're starting to work with clients. And a lot of these assessment guidelines and procedures we mentioned, they just toss them away. They just simply do a movement screen. Folks, if the doctor, therapist, or chiropractor referred this client to you, they're expecting you to do a thorough assessment to get an idea of the client's functional capabilities. And then with that, to have some means of measuring the client's improvement as they work with you. So it becomes important that you use and understand the key assessment procedures for the client so you can make sure you're establishing a baseline when they come in and they start with the assessment. And then periodically, every 30 days, every 8, 9, 10 visits, whatever you want to do, or every time they go back to the doctor, therapist, or chiropractor for a follow-up visit, you can now say, we assess these on day 1. The client has now gotten to this point on day 31, so we see progress. So it becomes important that not only do you understand the related anatomy and pathology, the contraindicated activities, but also the key assessment procedures and guidelines you need to follow based on that client's medical condition. Now, all of these things that we talk about here in our 6-point client management system are reflected in our advanced medical exercise specialist manual. I know some of you out there have actually taken our MES course. This 6-point client management system is outlined in the advanced medical exercise specialist manual, as well as every other advanced assessment concept, process, procedure. We've put it in this manual. The manual right now is 1,228 pages. And you have to forgive me, folks. We actually sold our last copy we had in stock yesterday. They're going to restock us again next week. And this manual has protocols, assessment guidelines, sample documentation forms. We actually have a library of medical exercise programs you can use for your clients with various medical conditions. You'll also get access to our resources library, which is a video library showing different assessment procedures for range of motion, goniometry, muscle testing, some special testing procedures. And you also get a 3-month membership in our MES network, which is a place where we have a wide range of courses and other things available to you that are the foundational components you need to provide medical exercise services. We put all of this together because we realize there are a lot of certifications popping up out there. But with those certifications popping up, the key thing becomes, do you know how to manage the client? A lot of certifications, you read a book and take an exam. Folks, this is the operating manual for medical exercise specialists. This is the advanced ones, not the MES course. This is the advanced stuff. And it's 1,228 pages of detail. If you want to get a copy, go over to amesmanual.com. It takes about 10 days before we ship the hard copy. We do have a digital copy that's available. Quite honestly, folks, I recommend the digital copy because you can take it any and every place with you when you see clients. And if you do order the hard copy, you will get a digital copy also. So go over to amesmanual.com. Let me keep talking about this 6-point program. So the 4th item on the 6-point program is incorporation of indicated activities and exercises. These are the good things. This is the stuff you want to do with the client to improve their strength, their flexibility, their balance, their function, their stability. So these are the things that are essential. Please, if you would write this down, you should have at least 3 essential activities or exercises you're going to do with this client every session. The 3 core things. Let's give you an example. Let's say you have Mrs. Fletcher that comes in. For some reason, Mrs. Fletcher runs late getting to her appointment. Her appointment is normally a hour-long appointment, but she shows up 20 minutes late. Okay, what are we going to do now? It changes everything. But those essential exercises become the things that you want to do. So always incorporate the indicated activities and exercises. So when that client walks in the door, you think initially of the related anatomy and pathology of their condition. Number 2, what should I not do? The contraindicated activities. Number 3, with this new client, how do I assess them? And then how do I reassess? What are the procedures? What are the guidelines? What are the key functional outcome measures I need to look at? And number 4, with this client, what are the activities that are essential? What are the muscle groups? And what are the exercises for those muscle groups that I need to work on in each session to see progress with this client? Now, the exercises may change as the client progresses, but what you always need to have an understanding of is what are the indicated exercises I should do? And more importantly, what should I not do with this client? Now, understand progression guidelines and functional goals. Now, folks, I think this becomes important, especially now as we're seeing more and more medical exercise specialists receiving insurance reimbursement for medical exercise training services. Now, let me make a quick point on that. If you're working with a client that's covered by Medicare or Medicaid, they're not going to pay for it at this point. If you have a client that has a third-party carrier, maybe a workman's comp claim or another third-party private insurance carrier, there's a strong possibility you can get paid, but you need to make sure you understand progression guidelines and functional goals. Now, when that client contacted you for that first visit and they told you what their diagnosis was, and you started thinking about the anatomy and pathology of their condition, then you understood the contraindicated activities, then you understood the assessment, the key assessment procedures, then the activities that were indicated. What you should have thought next was, okay, we've assessed the client. I know what exercises I should do. Okay, what are the progression guidelines? How are we going to progress this client? But more importantly, what are the functional goals? Functional goals. Goals that says Mrs. Smith now can climb 2 flights of stairs without getting completely out of breath. Mrs. Smith now can go for a walk in the community around her home without having to stop and sit on the park bench for 10 or 15 minutes. Mrs. Smith has enough strength now to climb the stairs. Mrs. Smith now has enough strength. She's going to go to her grandson's wedding, which is being held in Jamaica, and she'll be able to have enough strength and balance capabilities that now she can go out and walk on the beach and be there with the rest of the family rather than sitting up on the deck and just watching. So functional goals. With those functional goals, how are we going to progress the client to that functional goal? Please, if you would, make a note. As you start dealing more with insurance carriers, you're going to have short-term goals, 30-day functional goals, and then long-term goals, 60 to 90-day functional goals. The goals must not just simply say improve strength, improve flexibility. The goals must say improve strength, improve flexibility to allow Mrs. Smith to walk a quarter mile on unlevel surfaces, to be able to lift her groceries so when she goes to the store, she could be independent, getting her grocery bag out of the car and walking into her home. As we're starting to deal more with insurance carriers, the insurance carriers aren't asking you to take the place of the physical therapist or the occupational therapist. What's happening is they're cutting back on physical therapy and occupational therapy services, and now clients are coming to you. You can get reimbursed, but the question becomes, are you outlining the functional goals for the client and presenting those in the form of 30-day to 60 and 90-day goals? So the insurance carrier can look at that and say, your exercise program reflects the improvement in the client's function. Your goals are realistic, and we're seeing steady progress toward those. Not taking the place of the therapist, but simply saying the therapy is done. Now you need an ongoing exercise program. So that's number 5. Understand progression guidelines and functional goals, which takes us to number 6. Use a protocol-based approach. Now, I know some of you say, well, Dr. Mike, I've been doing this for 20 years. I know what I'm doing. Granted, you do. I've been a physical therapist for 45 years. I've owned 9 clinics and at the same time have taught at numerous universities and presented at numerous national conferences. Great. Guess what, though? If I see a patient, we're still using a protocol. The protocol doesn't handcuff me. The protocol says nothing is going to fall through the cracks. Working on flexibility of a small muscle group, working on stabilization activities for a certain activity. If I have a protocol, the protocol allows me to make sure everything gets covered from the assessment to the exercise to the progression. It even helps me with determining the 30 and 60-day goals. So a protocol-based approach isn't a problem. And what the protocol says is we're going to do the same thing effectively and consistently over and over again. Does the protocol lock you in place? No. The protocol just simply says we're going that way. These are the components of going that way. And along the way, if the client has any changes or deviations or modifications that are necessary, no problem. Go ahead and do it. And think about this. I manage the condition, but I train the client. I manage the client's condition with a protocol-based exercise approach. But I train the client because maybe my client with the total hip replacement also is diabetic or maybe had a stroke. The primary condition they have is joint replacement, but the client also has hypertension, diabetes, or maybe a stroke. I need to modify the exercise program for that. So I manage the condition with a protocol-based approach, but I train the client by making modifications so that we can accommodate this client's particular needs, whatever they might be. Comorbidities, maybe they have a limited budget, whatever the case is, we're able to accommodate the client, but we use a protocol-based approach. That becomes vitally important to make sure that we hit all the goals, that we avoid any contraindicated activities, and that we produce a positive functional outcome. So we've been teaching this now for probably 20 years. We modified this, upgraded it, so that now for any condition out there you're working with, this is how you're going to manage them. And it does make a huge difference. So please, folks, this isn't anything that's rocket science. It's just simply the thought process that you have in your head from the moment that a new client comes in, all the way through every session until they're done with you, based on the goals that you've established. Once you've gotten the client to those goals, the insurance carrier may say, hey, we're not paying anymore. But what we may find is the insurance carrier may reimburse at a lower level just to maintain the client at that level, or the client may pay. When we're managing the client with a medical condition, it is finite. Can they come back after a bout of not working with you for a period of time? You said, hey, you've reached your goals, you're doing great. Now they come back 9 months later and they say, okay, I need a retune. Fantastic. That works, and it works well. So with that, let me also tell you about a couple other things. Again, don't forget about that advanced MES manual. If I were a medical exercise specialist, and I've been training them now for 31 years, this is the essential guide I would get. It gives you everything we've done in the last 31 years. If you're out there, and I see some people that I've known for a number of years, get yourself a copy of this. This is the next level, and this is the operating system for medical exercise training. Also, we have a new course coming up, Essentials of Medical Exercise Business. Now, our first day will be here in April 27th here in Houston. We're also going to do this course in Washington, D.C., Chicago, New York City, and San Francisco. This is where MET skills meets business strategy. So if you don't mind, let me ask you a couple questions. If you want information on this, go over to medicalexercisebusiness.com. But here are the questions. Do you consistently get referrals from physicians and therapists? Consistently get referrals from physicians and therapists. Consistently. Not one every 6 months, but on an ongoing basis. Number two, do you know your overhead cost to deliver a training session? How much does it cost you to deliver that training session? Number three, are you able to take time off without losing revenue? Can you go on vacation and not lay there on Thursday when you're coming back on Friday and like, oh my God, I lost so much money? Next, do you use a documentation, intake, or follow-up system that's consistent that allows you to communicate with doctors, therapists, and chiropractors? Next, do you confidently talk to physicians and therapists? Some of you on this call I know I've met, and I've known you for 20 plus years. I know you're doing it. But let me ask the question to the others. Are you confidently talking to the doctors, therapists, and chiropractors out there? And are you promoting your practice to these medical providers? And last question, have you ever built an insurance carrier for your services? I'm just asking. If you are saying no to any one of these, or let's flip it, you're not saying yes to all of them, you might want to look at this class we're offering. So what you'll learn: how to define and operate within your MET scope of practice, how to establish professional standards for your practice, how to structure the client intake and the assessment for credibility dealing with the medical community, how to implement documentation and communication systems. If a client comes into your practice, they have a medical condition, and they have a physician, chiropractor, therapist of record, and you're not communicating with them at all, you are not providing medical exercise training services. You're just doing personal training for a client with a medical condition. So please make sure you communicate with the doctors, therapists, or chiropractors. This course will also teach you how to set up a billing and reimbursement pathway. It will help you with marketing your services to clients and referral sources. It'll help you build lasting referral relationships, because those referrals should be ongoing for you. And it'll help you add multiple streams of medical exercise training income to your practice. So the course is a one-day intensive course. We start at 8:30 in the morning. We talk about scope of practice, pricing, MET practice management systems, insurance billing basics, marketing your MET practice to the general community as well as to the medical community. We also talk about establishing a referral network. How do you do that? How do you approach the doctors, therapists, chiropractors? What do you say? And at the conclusion, we're going to actually go over a workshop summary to help you put all of this stuff together to go back home and make it work. Go over to medicalexercisebusiness.com. We're only taking 10 participants. Now, some of you may say, I don't want to attend the course, but I want to get my practice ready for accepting insurance reimbursement and starting to develop those medical referral relationships. Go over to medexprobusiness.com. We have a jumpstart coaching program. It'll walk you through everything you need. Thank you for joining us. All the best to you. Have a great remainder of the day and have a great weekend. And again, email me if I can be of service to you. All the best. Take care.